Hello, everyone, and happy Friday. Well, we are bringing a very interesting topic today, uh, physical therapy for pelvic health. Well, we have Dr. Karah. Dr. Karah is joining me live from Oakland, California. She is a physical therapist, yoga instructor, Pilates, and dancer all in one. Thank you so much, and I'm so excited to have you here.
Thank you for having me.
Great. Before we go into how physical therapy helps us, let's just understand what exactly is pelvic health.
Yeah, so pelvic health, specifically in the world of physical therapy, is really acknowledging the fact that we have a pelvis, and within that pelvis, there are muscles called your pelvic floor. And I think a lot of people don't even know about those muscles. And so, as physical therapists, we're specialists with muscles, with movement, and a pelvic physical therapist is going to be a little bit more specialized with the pelvic floor muscles and generally the whole core as a result, because those muscles play a big role in core stability. And so I think one of the biggest things we try to advocate for and talk about is within pelvic health, we like to address the three main things that can actually go wrong just due to your pelvic floor muscles, which are bowel and bladder, sexual function, and then of course pelvic pain. So those are the main things that we can actually address just through the lens of your pelvic floor muscles. And a lot of times those issues are addressed more medically with medication and things like that. So it's exciting to know there's a more holistic approach to it.
I think that's fascinating. I mean, most of us go through one or the other during our journey, right? The women's health journey. So
Yeah.
let's just talk a little bit of, you've got an amazing toolbox here. So how do you use it to help with the pelvic health?
Yeah, so generally speaking, as a pelvic floor physical therapist and having all the background I do with movement, I would say it's a combination of a few things. One of the things that makes my specialty unique is that to be a pelvic floor specialist in physical therapy, you go through extra training to do intravaginal and intrarectal work, meaning that we actually do internal work, just like if you went to an OBGYN. The only difference is that when you're seeing a physical therapist, our focus is really on those pelvic floor muscles. So we're actually going internally with consent, of course. We don't have to do this. We can actually still assess the muscles externally, maybe not to the same degree. But this allows for us to actually see what's going on with your pelvic floor, what's the tone, what's the coordination. And then as a pelvic floor physical therapist, I'm trained in a lot of manual techniques. So being able to actually engage with those muscles, providing new neural input. Let's say they're really hyper engaged and protective. We can actually do techniques to help those muscles release. In addition to that, I am also trained in techniques for the viscera, which is very much linked with the pelvic floor. So if you think about the organs like the bladder, the kidneys, the liver, these all play a role in core function. And I don't actually manipulate those organs. I'm not like moving your kidney, but what I am doing in those techniques is, again, I call it like having a conversation with the nervous system, coming into the area where the kidney is and having a conversation with the somatic framework. So maybe the fascia around the kidney, for whatever reason, traumatic injury, whatever it might be, has decided to go into protection mode. We can get in there and actually help that kind of change its game. And so definitely manual techniques are a big part of what I do. But in addition to that, I'm a big believer in movement and getting to the root cause of why things have dysfunction in the first place. And so being a physical therapist, but also being a dancer, a yoga teacher, and a Pilates instructor, with my clients, I'm often using manual techniques, usually to get them out of acute and immediate pain, and then using movement for more sustainable results. So actually getting to root cause of your movement, what are your mechanics, and then getting you to integrate into movement that feels sustainable. Ideally getting back into like a group class, because we know there's a lot of benefits to moving with groups of people. A little harder during the pandemic right now, but generally that's like the toolbox I'm using, is using manual techniques and then getting all the way back to movement.
Okay, that sounds great. So other question is, what age group that you see that women are having this kind of problem? Do you see some kind of a pattern, or is it all across the board from puberty all the way to menopause?
It's a good question. I would say that I'm seeing people of all ages because there's different issues that will present. I would say that with pelvic health, two age groups in particular, are especially for female identifying people, would be when women are starting birth control. I have found that birth control actually has links to creating pelvic pain, and that could be a whole other seminar. But different birth controls and that kind of period certainly can create some pelvic pain. And then we also see a lot happening in menopause. And both of these reasons, the pelvic pain is happening, is due to hormonal causes. And so again, even though I'm a physical therapist, and I'm not prescribing anything, I have to be aware of how hormones play a role in muscle function. And so I would say those two age ranges are big ones, but then everything in between, particularly another age group or area that we focus on is postpartum care, and even during your pregnancy as well. So that would be probably what I see the most of.
Sure. And what kind of issues can happen to transgender community, which we don't talk about?
Yeah. So with transgender care, I think I've actually worked with a few clients, particularly post-surgery, if they did a gender affirming surgery. And sometimes there can be issues. I mean, you think about any surgery in our body, and that's a relative trauma to the body. You know, we think about if someone had a knee replacement, of course they would get physical therapy. But for whatever reason, when we think about abdominal surgeries, pelvic surgeries, delivering a baby, any of those things, it hasn't become the norm to also think, well, that's a surgery, we need rehabilitation. And so I would say in the transgender community, a big area where pelvic PT can help is certainly post-surgery, but we also can talk about prehab, getting in before the surgery, because we want those muscles and fascia to be in the best position possible. So then post-surgery, there's not as much effect with the scar tissue and those muscles going into that guarding place. So that would be probably the biggest thing we can help with.
All right. So maybe a few tips you could share. This is a quick 10-minute session that we do on a daily basis just to bring a quick wellness tips. Anything you could share, like what we could do at home, some yoga poses, some dance movements, or maybe Pilates. I know you can't demonstrate it here, but maybe you could help us.
Sure. I think probably one of the quickest tips I could give is having people understand, if you've heard anything with pelvic health, I feel like what most people have heard is to do Kegels. And what I'm trying to get people to understand is that Kegels, although not totally wrong, and we could go into a whole other seminar on that, they're over used and over talked about. And what people are often taught is like, oh, you just got to tighten and engage your pelvic floor. When the reality of what I've seen clinically is that most people's pelvic floor dysfunction is due to the muscles being over engaged. And so if I were to teach anyone anything, I would teach them that what we need to focus on is a little bit more of that relaxation piece of the pelvic floor. And one of the best ways to do that is diaphragmatic breathing. And I could probably spend like 5-10 minutes explaining what diaphragmatic breathing is, but a quick way to explain it is really understanding how to breathe into the rib cage and belly rather than just the chest. When you breathe into your rib cage and belly and allow for that expansion, there's actually a connection to the pelvic floor, and those muscles start to expand as well. And this is one of the best ways to start to understand how to get your pelvic floor to relax.
Wow. Any asanas? Any particular yoga movement?
Yeah. Yeah, good question. I would say my top 3 yoga asanas that do relatively stretch the pelvic floor would be Happy Baby, Child's Pose, where your knees are a little bit wider, and then Yogi Squat Malasana. So when you're in that deeper squat, those are all relative stretches. And I say relative because it, of course, depends on how you're doing it. So if you're in those positions, but you're still gripping, there are probably ways that we could get you to relax or breathe differently to get those muscles to relax. But generally, those are some good ones.
Great. Thank you so much, Dr. Karah, for being with us. To everyone else, to all the women out there, we know that we need to take care of our pelvic health. We just don't talk about it, and that's why we wanted to bring this very interesting topic today. Have a great weekend, everyone. Anything else you'd like to add before I wrap up? Thank you so much.
Just thank you so much for having me. I really appreciate this.
Absolutely. Thank you, everyone, for your support. We're launching workshops, so stay tuned. Thank you, and have a great weekend.